This 30th episode of the Peace on Drugs podcast is brought to you by the strange American phenomenon of pharmaceutical advertisements. We are one of only 2 countries that allow it, and the only country that allows this sort of psychological manipulation when it comes to side effects and exaggerations of effectiveness. If the medication works, then doctors can do their research and then inform their patients. Why are drug companies informing patients who then ask their doctor? This seems backwards. But it's done this way because convincing people that a drug may fix them is the best strategy to push product. They start with telling you your symptoms and showing you someone suffering. Do you have trouble sleeping or irritable bowel syndrome? Or do you suffer from anxiety? Perhaps anxiety over an irritable bowel that is causing insomnia. Then they tell you a brand name of some sophisticated yet soothing sounding drug, a name that was test marketed for maximum sellability. If you suffer from any of these symptoms, then Hevextocin may be able to help you. Ask your doctor about Hevextocin. Next comes the side effects, which they legally have to tell you, or they definitely wouldn't. But while they tell you some of the grossest and most awful side effects you may have ever heard of, they cut to a person who was sick, now cured. It's the happy ending part. Maybe there's a violin playing, a family on a beach, or a man with his dog. They speak in a soft, soothing voice. Hevextocin may cause severe anal bleeding, dry mouth, and loss of hair. If you have a family history of high blood pressure, Hevextocin may cause stroke, heart attack, and not so spontaneous combustion simultaneously. Hevextocin is not for women or men who are pregnant or breastfeeding, as fetuses may grow tails and little devil horns, and infants may develop reverse elephantitis. This is where the head stops growing, but the rest of them keeps growing. Hevextocin's name was formed by combining the word for the mother bonding neurotransmitter oxytocin with the word heaven, because 1 out of 10 who take Hevextocin will end up there prematurely. Ask your doctor about Hevextocin and get your life back, or start living tomorrow today, or a journey of 1,000 miles starts with 1 step, and that step is asking your doctor about Hevextocin, or some kind of bullshit like that. All right, Peaceniks. Today's guest is the stationary astronaut Nick McLaughlin. He joined us from Rochester, Minnesota, and we had a fantastic conversation. He talks about his trips into the Amazon, doing ayahuasca, and his spiritual journey. We talk reincarnation and the afterlife and the war on drugs. We cover some ground. Check out his podcast, The Stationary Astronaut. And come on, Peaceniks, let's do the damn thing.
America's public enemy number 1 in the United States is drug abuse.
Drugs are menacing our
What are
society.
your thoughts on the drug problem?
I had a great time doing drugs.
So tonight, from our family to yours, from our home to yours, thank you for joining us.
This is the Peace on Drugs.
All right. We in this?
We're in this.